Hi there guys, welcome to today's live stream. We're going to be talking all about neck pain, how neck issues can lead to shoulder pain and arm pain. So hopefully we'll be able to give you guys a better understanding of why this happens, how this happens, the similarities between this and lower back pain as well, just so you can really understand these things. And if we understand these things, then we can more effectively treat them. You'll see as we go through today's live stream, we're going to talk about it for a sort of second. Got some pictures on the board that are expertly drawn before we started the live stream. We've got a little bit of sort of the background information about why these things crop up, especially with modern life. And then at the end, we'll go through a few bits on what you guys can do, why it works, and to really help deal with the neck and shoulder pain, because it is something we see in the clinic reasonably frequently. Obviously, the bulk of the patients coming in with lower back issues, and then the second most common is going to be neck issues, where we've got damage or degeneration or injury to the neck itself. So we see these things a lot day in, day out, and there are so many similarities between both the neck and the lower back. They both should have a backward bending curve, slightly different anatomy in the neck. As the lower back, it's a nice backward bending lordosis, and that is allowing them to effectively load bear. And in the neck, I would say that clinically speaking, we do obviously a lot of images, so we understand what people are coming in with from that point of view. We tend to see necks that are objectively more misaligned than lower backs. We very, I think it's 4 varies, infrequently see people with too much neck curve. Most of the daily living that we're doing, we'll see why this is a little bit later on, is putting a substantial reduction through the neck curve. And I would say that people will more commonly come in with a objectively worse neck curve. Necks that come into the clinic, or people with necks that come into the clinic, which is everyone, people with bad necks that come into the clinic will frequently have a worse objective neck than a similar person that comes in with back pain, the misalignments in their lower back. So it's worth bearing that in mind first and foremost, because it maybe gives sort of a few clues about how these things can build up. So first thing is, I've got sort of 4 points here for you guys to consider. The first one is your neck posture. How are we holding our neck on a daily basis? Are we holding nice and tall, or are we slouching over forwards? And as we go forwards, that puts a reduction through the neck curve. It also shifts our head forwards. Now, our head is about the weight of a bowling ball. It does vary person to person, but that centre of mass going forwards not only affects the neck, but also has a tremendous effect that needs to be resolved with the lower lumbar spine. So we do frequently see necks as an issue that can have a knock-on effect on the lower back and the overall lower back health and well-being. So that's very, very important first and foremost. The second one down here is smartphones. The use of smartphones, and that includes reading. A lot of people say, oh, smartphones are bad, go and read a book instead. The mechanics of using both of those involves being like that. People will read in bed like that, or they'll put on their smartphone like that. They are the same thing fundamentally. Obviously there's numerous other disadvantages with the phone as well. We've got the blue light and all that other sort of stuff. But when we're doing these things, be it reading or smartphone or tablet or computer in bed, we need to be sat up square, have it at eye level, so we're not looking down. Now I think we're on maybe live stream number 143 or something like that, or 140, I think it is actually number 143 today. On probably 141 of those, I've mentioned that we do imaging in the clinic and we do correction in the clinic. And that is changing the shape of this neck curve over a period of time, and the same in the lower back. That's what we call the spinal remodeling. I will remind you guys again, the way that works is holding a part of our spine, the neck or the lower back, in a set position for 20 minutes a day for 3 months to 4 months will often result, or will result, in a 20 to 25% increase in the curve, or change in the curve. So if we're on our smartphone 20 minutes a day still, with a static stretch through those structures, we will get that change in structure, change in underlying structure in our neck. Our body changes in accordance with how we use it on a daily basis. We will find that the implications of that mean that there's no good supporting structures through here, so the neck's much more wobbly. So when it does eventually become injured, we have a little bit more of a challenge in our way to actually overcome when it comes to recovery. So that's very, very important also. How much time are you spending using that smartphone in a bad position? It's not a problem using it, but we need to be smart with the way in which we're using that smartphone. So that's very, very important. The next one is that neck and arm pain hurts. So does back pain. But from a practical point of view, doing those exercises that are commonly recommended that increase the size of these little holes, basically the wrong exercises, that sort of stuff, and stretching and this and that, Those sorts of exercises are a lot easier practically to do. You can do them when you're sat in the car, you can do them when you're sat at your desk. Doing the same exercises like the knee hugs that we really steer you guys clear of in the lower back, it's maybe a bit more practically difficult to do. You'd have to get down on the floor in the middle of the office and do it. Whereas people will regularly reinforce this injury pattern at their desk, at home, while they're cooking the food, etc. Because it's so easy to just pull that neck down like so, and it feels good. Why does it feel good? Because these little holes here, they open out when we do those movements, they get larger. And most of the pain is going to be coming from a build-up of inflammation in this little space where the nerve comes out. So if we can momentarily make that hole larger, then we can really help immediately take a little bit of pressure off that nerve. Problem lies in the fact that doing so, there are other ways to take pressure off that nerve. We'll get to that a little bit later. But in doing so, we're actually pulling the wound apart. We're potentially damaging structures further that stabilise that segment, leading to a vicious cycle of more inflammation, then more pulling the head forwards, then more inflammation, then more pulling the head forwards, and then you get a patient that will then end up coming to the clinic after 6 weeks or 6 months of this sort of stuff, and their head's just wobbling around the place. It's got no support whatsoever. So you try and do a treatment, or you do a treatment, or they do the right sort of things, but they've lost all the stability for the neck. So they're just so prone to re-injuring the thing, it's really, really difficult to get past. Not to mention the fact that if we're also an avid smartphone users, and we've seen people come into the clinic for cycle decompression. So we do treatment, we use the vibration, we use the laser, use spinal decompression, the IDD machine, works fantastically, oh, I feel good. And then we see them at the lift out the front of the clinic, checking their phone. And they just think, it's gone in one ear and out the other. It's really, really disheartening because you see people just making these mistakes over and over again. And that's why we talk so much, or I talk so much about that 168 hours in the week, what are we doing outside of our practice? And this goes, I know we're talking about the neck today, but this also goes for the lower back. And that's why we do these live streams, to try and help you guys understand that as well, so then you can more readily adhere to it. So although it feels nice to pull your chin down to your chest, please try and avoid it. It really is not going to be helpful. And sleeping with 2 or 3 pillows, propping your head up, is also obviously a big no-no, because you're going to sleep in that position for much longer than 20 minutes. The final part, which I've kind of already covered, is just that lack of understanding. We don't understand what's going on. Maybe we don't have the time to explore why it's going on with our practitioners or our advisors in that respect, and therefore we can't get a full grasp on these things, and therefore we don't change it. The same way, I've mentioned this, I think, yes, on yesterday's live stream, if your son or daughter is skidding with their bike and their bike keeps puncturing, you have to say to them, hey, look, if you stop skidding, you're going to stop wearing the bike tyre out, and eventually that message will go in and they'll stop skidding the back brake, hopefully. But you get the message. If we can help you guys understand this, then you'll be able to stop making some of these mistakes. Now when we get to the actual crux of it, this is a very crude drawing of you from the back. Maybe you have shoulder muscles like this, maybe you don't, that's by the by. But we all have the vertebrae. You see the little green bits in the middle here? Those are your bones. And my very good artist impression, looking from the back here, the blue bits are the nerves coming out. Now, you might recognise this from the lower back. It's contributing towards the sciatic nerve down here. Well, up here they form what's called the brachial plexus, which is basically a collection of nerves that come out of the neck and go to different parts of the shoulder girdle, our pecs, our deltoids, around the back here over our shoulder blade, etc. And it controls all these areas. And the same as sciatica can be incredibly debilitating in the leg. It's exactly the same process here. It may be that it's affecting the nerves that go down into your hands. It may be part of the arm hurts. It may be the shoulder. It may be the shoulder blade. It may be coming up to the neck. All these different permutations of what you may be experiencing will all be essentially, or can all be coming from the neck here. And we should really take care to identify that the neck is fundamentally normal before we start proceeding to looking at these local tissues. Because short of getting the common sort of epicondylitis or tennis elbow, golfer's elbow, it's very difficult to really injure these sorts of structures. And maybe we've got supraspinatus in the rotator cuff as well. But to injure the muscles that are on the side here is rather difficult. So it's generally going to be something else that's causing that. And in a lot of cases, it's coming from the neck, irritating these muscles the same way we see in the lower back with the hamstrings, etc. And that's creating your trouble. So it can go anywhere down here, and it can vary and it can fluctuate. And if we have discal issues in the neck, in this region, it can swap sides as well, which is normal. And that's not necessary to say that the problem is actually getting worse when it does swap from the left to the right or vice versa. It's just that a little part of that area has been injured, and we touched on chronic back pain earlier this week. about a specific part is injured, but our brain maps it out as sort of a football field, and we say somewhere in this area there's something going wrong, and in fact it's a much smaller area that's actually injured, and that's going to be somewhere in this region here. So if we zoom in on one of the vertebrae themselves, we've got a nice healthy vertebral unit, and this obviously looks more like a lumbar vertebra than a cervical vertebra, but you guys get the picture. We've got the nerve in the middle, we've got the disc here, we've got the facet joints coming over here. And when you guys are stuck in that forward bending position with the neck, we're driving too much pressure, and if we do this in red, through the front of those discs. And guys, if you have any questions on any of this, please do post it in the comments below. Lara's over there, we'll get to Q&A at the end as well. So as I'm going along with this in a bit of detail, don't forget to get your questions down, okay? So, as we're doing this, we drive pressure through here. This starts to become injured because the discs are being pulled apart. They're supposed to deal with compression, not sustained stretch. And then some of the ligaments here will also be pulled apart as we move into that position. And you can actually see this on the x-rays. It's really fantastic. Fantastic that it's clear, not fantastic that it's there. That these bones should be very close together to provide stability. So if we have, say, a whiplash, something like that, it all unloads at the same point. But what we often find is they're spread out like that, and that's the status quo. That's not stable, that's not supported, and it's not going to do well if we go over little bumps or things in the car or have slightly sort of minor knocks, etc. So these ligaments all become weakened and maybe become injured. And then the inflammation builds up in this area here and starts to irritate that nerve. So what do? We lean forwards like I mentioned earlier, and that opens out this space so it decreases the pressure. Now I'm going to get to this a little bit later, but some of the exercises that we recommend involve you coming back to a normal position and putting a bit of stretch through the spine. And the problem is, if this hole up here, where this nerve comes out, is now that big instead of that big, and your neck's bending forwards substantially, like so, and creating a massive strain on these discs, it's very difficult to come back to neutral, which is why we gravitate to just make it worse by pulling forwards. And because we are a little bit more locally sensitive in the neck than the lower back, it does become quite difficult to really bring that head back. There's also not as much room as the nerves are leaving in the neck as there is in the lower back, so it's worth bearing that in mind as well. Then we get to the final position. Now I do want to talk about this specific point because it alludes to the exercises that we recommend you guys do later on in terms of relieving this sort of issue. Now, a lot of times patients will have been told elsewhere, don't do extension in the back bending, and that's really because there's some arteries up in the top part of the neck here which run through a bit of a tortuous route at the very top of the neck, at this junction just up here. None of the others, just this one here. And it's important that we don't put excess extension through there for obvious reasons, which they'll be able to explain to you happily. But what we find is in a neck that is going forwards like so, like this here, this area is jammed up. And the result of this area being jammed up like so, you see that the back of the bone is very close to the skull here, is that is stuck in permanent extension. Now what we're getting you guys to do when we recommend the towel and the band exercise in a moment is put extension through here, where it should be, which allows this vertebra and these vertebrae to reorientate, so we reduce the extension at this segment here and bring it back to a safer position. A lot of practitioners just don't have this detailed understanding with how the spinal alignment works, and what is essentially happening is when our neck's going forwards, this top vertebra that I mentioned, you can't see the skull on this image, but this top vertebra has to pivot back, and that creates a lot of compression. It can also give things like headaches, etc., which we won't get into on today's live stream, but that's by the by. And you always, as a practitioner, especially if you're doing manipulations or mobilizations, we want to avoid extension of here or excessive relative extension, i.e. pushing into a more extended position with other movements as well. So when we get you guys to do flexion, they will say, pull your chin to your chest, which opens this area out a little bit, yes, but we can't walk around like that, because it's not very practical. We walk into things. Whereas if we get the right movement through the right part of our neck, often it's this part that's injured, this is just compensating anyway, and we can get it back to the right position. You notice how this can sit pretty again. It can sit perpendicular to the axis of the spine, and that makes a massive difference. It takes pressure off here and puts it back to a safe position, and actually we're putting extension through the lower part of the neck and the middle part of the neck, as it should have, to remove it back to neutral, a nice neutral curve, so that this top can move back into its resting position from a position of too much backward bending back to neutral. So it's very important that you understand that, and once you discuss that with your practitioner, maybe they're going to be able to say, yeah, that makes a lot of sense. So it's very important. People often don't understand the implications lower down the neck, and it's always, or very, very frequently, this C4, 5, 6 region that is the one that's getting injured, and that's the one that's going to give you stuff out here, down, and into this area of your hand as well. So, just before we get into the action points, what have you got to do? I want to touch on heat very, very briefly. If any of you decide you want to, whether or not you've got neck pain right now, you go and stand in a warm shower. Maybe even if you don't have neck pain, you go and stand, warm shower in the back of your neck. It feels lovely. It does. If I've got a hot water bottle, put it on the back of my neck, it's lovely, it's relaxing. That's why they have heated seats in cars, because heat feels nice. Heat feels nice does not translate to heat is fixing my neck or heat is fixing my back. It just feels nice. If someone was to tickle you on the back, it would feel nice. That doesn't mean it's helping you understand problems in your neck. So I really want you guys to steer clear of heat, because yes, it will make the muscles more pliable. We're not dealing with a muscle problem here. We're dealing with an injury to the tissues and in and around the spine. So using ice is always going to be better for these sorts of scenarios. We use ice directly over the spine, and we don't hold the ice pack like so. We use a towel or a band to place the ice pack on our neck, yes, but then use the band to hold it in place. Now my neck's nice and neutral, rather than wandering around the house like that for 5 minutes after I've done my exercise. That's not going to be very helpful. So do bear that one in mind. Now let's get on to the action points. I'm going to go through these nice and swiftly, and then we'll get into Q&A, guys. So first and foremost, address the above points. If we ignore those points, then we can do all we like. But like the people that walk out, or like it doesn't happen very often, but like for the occasions when it does happen, walking out of the clinic after having a neck treatment and then going down on your phone, or I'm constantly saying, get your bags off the floor and get them onto a shelf or onto a chair so you don't have to bend down. If we're doing those sorts of things outside of the good things, then we're going to get in trouble, and that's why in the back and shape with regards to back pain, we cover these things time and time again to try and help you guys understand the things that you're doing wrong outside of the issue. So that's really important. Then we get to the actual active bit. Band exercise. Super, super simple. Get a strong band. I'm using the green one here. Many of you guys have the resistance bands at home. Use the strongest one you've got, because you don't want too much give. I'm just using this so you guys can see where it is. Now, we are not, I repeat, we are not putting it up here and going like that, because that will make this worse. It's putting it in the mid to lower part of our neck, and we are gently pulling forwards and looking up at the same time. We are looking up like so. We are not looking up like that. That is just this top vertebra moving. It's a very mobile vertebra. Most of our movement actually comes from this top part, and one of the reasons neck pain can get substantially, or neck problems can get substantially worse before they become painful or sufficient to see someone, is because, unlike our lower back, even if we're desk bound, we can still look around every day. So we keep a bit more mobility in the neck, and it prevents inflammation building up excessively. So that's the first one. We do 15 reps of that, and this is written on the board anyway, guys. Then we need a towel. Towel rolled up the same part of the neck, middle part of the neck, and support you right in here, right underneath this part. So we're laid on our back, just over the towel. You do that for 3 to 5 minutes. That is the one that I mentioned earlier. It will potentially be a little bit uncomfortable to start with. Now, we will find that this gets easier with time. We hold our head, we roll off. We actually have lots of guidance on how to do this particular one on the YouTube channel as well. So if you've got any queries or any concerns, go ahead and watch the videos, because we go through it in detail on how to do it correctly, how to do it safely. We have patients with all sorts of problems coming into the clinic, from the very minor to the much more severe. And when we do this exercise correctly, it helps. It is normally, much like the lower back towel exercise, a challenge to start with, because the problem of the alignment is so commonly not where it needs to be. So it really is changing that structure, but it is good for you. It really will help. So, final one. It's going to be used ice over the same region, middle part of the neck. As I mentioned, use something to hold it in place, and then just get on with your day. 3 to 5 minutes. You can do this routine. It'll take you around about 5, 6, 7, 8 minutes, obviously plus the icing. And we can do this 3, 4, 5 times a day. We can do it more frequently during the day. And what you should find is the towel will first get easier to do. The banding should feel rather strangely pleasant. Quite often you'll find that if you just look up, and if you look up with the band, you'll find that it moves easier, it's more comfortable, especially if we're pulling gently to the right spot, and that's because that normalises the movement, and it helps stop this misalignment side of things happening and restore normal mobility. One final example before we get into Q&A that really illustrates the band when we move, we can only pull the muscle on the spine. We can't move segmental muscles. So when we go to look up, we essentially have an attachment point here and we just pull. Nothing changed. But when we use the band, we have that attachment point and we pull with a pivot. And it actually allows things to bend properly. So that's why it works. And it's a nice test that we do in the clinic, which nearly always, well, whenever we have these issues, it always shows that difference in how much easier it is to look up with a pivot than it is without. With that, we're into Q&A.
Okay, brilliant. Good morning, everybody. Please do keep your questions coming in. I do think we've thrown quite a few people this morning with the time change. I am sorry about that. Cheryl has asked a great question here. She said, the very top of my neck grinds and crunches when I move my neck all the time. I also have stenosis C6, C7.
Yeah, so that's going to be down the bottom part of the neck here. What I would say though is we have the ability, they've got these interesting hearing aids which you basically get implanted into your skull, which uses vibration. Quite often you will feel it in the top part of your neck, this crunching and grinding, but it may well be happening a touch lower down in the neck still as we're moving those joints. If it's the C6-7 sort of region of the spine, that's going to be down here, that's degenerated, and that would fit with what I've discussed. Neck going forwards too much here, and then we've got a bit of a pivot backwards. Also though, the other thing to bear in mind is much like the lower back, the L45 and L5S1 are most vulnerable. They have to accommodate the most change and most increased load. It's the same in the neck. We frequently see that the damage or degenerative process really does build up first in this mid to lower portion of the neck. It's very infrequent that you're actually going to have mid to upper neck degeneration first. It is really rather uncommon in my experience seeing x-rays.
Cheryl does say she does use the bands and the towel and the ice.
Yeah, for you Cheryl, I'll try and just get that band right down on. You'll find if you run your finger down the back of your neck, you'll hit the first bony bit that kind of sticks out. If you look up straight ahead, you're going to feel a bony bit that sticks out. That's generally going to be sort of C6 or C7. It does vary from person to person to a degree. You're going to hit that bit because you see that these are in a lot more. So you're coming down and now, boom, hit it. And that's really where you want the band to go. Maybe where your necklace might hang. If you're just wearing a necklace, and right down the bottom part of that neck, so we're coming through here, that'll just help open that C6-7 region. It really will. So I would definitely up gently, but focused. And remember, as I mentioned when I said do the extension, we don't. So if I put it right down the bottom here, okay, we start that, and then we don't want to do that. It's just my head is wobbling on my neck. Whereas if we do that, we're actually really getting the movement going through the lower part of the neck, through the pivot point, so that'll really, really help you get more focused movement.
Is it the crunching that you want to avoid? Because sometimes if I'm sat still for a long time, I will get a crunchy feeling as well, but then sometimes I'll get a pop. So which is better, which is worse?
So pop's fine, crunching is not ideal, but it's not really a problem unless it's painful. But what I will say is that a lot of people find that as the alignment of their neck improves, the crunching starts to subside. So a lot of it is you've got tissues that should run from A to B and they're having to run from A to B via C, D and E to get to where they need to. So they're flicking over all sorts of bits, and there's a lot of bony bits around here. The tendons and the ligaments, etc., just pulling and flicking over bits that they shouldn't be flicking over. And actually, you do find in a lot of cases when we realign the neck, we get the neck moving in the right direction and positioned in the right way, those sorts of things really start to abate, especially the need for sort of clicking your neck. A lot of people feel, I just need to get it to go, click. I know you were watching The Crown the other day, and that's that bit with Prince Philip, and he's like, just give it a good, and then he ends up in a collar. He ends up in a collar going to see, I think that was an osteopath actually. But anyway, I don't think that was very good. But that's by the by. But as we start to realign the neck a little bit better, you'll find that the need to do these cracks and the crunching and grinding feeling does actually quite commonly start to abate. It starts to go away.
Okay, awesome. Kate has asked here, despite the pain and numbness spreading down my whole arm and the constant headaches, is it still okay to continue the regular towel and exercise?
I do think we discussed a little bit in detail, Kate, the other day about this, and I think under normal circumstances, if you can categorically say that you've been doing this for a longer period of time, so if you're doing it from here to here, and we've had no exacerbation of symptoms, that hasn't been happening, and then we've had an injury event here, and ever since then it's been getting worse or hasn't resolved, and it's just been a feature more so since then I would say it's worth continuing to try and help it, because what else can we do to help the issue? That's the real challenge. What else can we do to help the issue? Especially if there's been sort of a whiplash or something like that.
I wonder, do you think biofreeze would be more?
I know that Kate does contrast bathing, which I think is quite useful. So
yes,
stepping out might be a route. Stepping up the contrast bathing, maybe a touch more frequently, might be a viable route to just help get it to calm down a little bit more.
Okay, brilliant. Hope that helps you, Kate. Sally has asked here, so facet joint degeneration and disc bulging, C4-5 and 5-6 noted on an MRI report.
Yeah.
No real discomfort, but I guess I need to be doing these neck exercises more and improve my neck carriage, especially when working, to help reduce further degeneration and future problems.
So one of the things I haven't covered because it's going down a bit of a rabbit hole, a very interesting research paper from a little while ago looking at patients with a fundamentally normal lower back. So they had lower back pain, but they had no, and this is objectively, no misalignments in the lower back. Everything was within normal range. And they found that the neck curve was something that really was impacting that. If we go back to some cadaver studies much longer time ago, I think this is sort of mid-1900s, you can actually see the effect of moving the neck forwards has on the tension through the spinal cord. So the essential outcome of that was saying that the spinal cord is more primed and more on tension. So for example, if we have a pressure, and I'd urge you guys to try this, if you've got the bands at home, try this maybe after this video. If you hold it there, inflammation in our neck or in our lower back is only something that's occupying a degree of space. That's where it comes in, it builds up pressure, so we might try wrongly some exercises to open out the space, so it decreases the pressure. But if we are displacing the nerve, and it's nice and floppy like so, and we displace it by a centimetre, this is something I get patients to do in the clinic, and you displace it by a centimetre, there's very little pressure on my finger and on the nerve. The tube doesn't really deform that much. But if I put a tension through there and then displace it the same degree, the same amount of movement, the same amount of distance while the cord is on tension, we notice there's a lot more local pressure is going to be observed. And remember, fluid excess inflammation is non-compressible, but the nerves are. If they're being stretched taut and then pressed, it can exert more pain. And basically the outcomes of the one study was that you found patients with a straight neck curve, i.e. more tension through their spinal cord and all the attached nerves are pulling through the system, suffered disproportionate symptoms relative to the injury and compared to others which had an otherwise normal neck curve with the presence of back pain. So it was very, very interesting that this is why we always talk about the neck in conjunction with the lower back, because it is one long tube. And if that's like that coming down your body, if I pull one end, the other end is going to move. And we have to bear in mind the interconnected nature of these things. And if we have two areas where we have a reduction in curve, that's an awful lot of change in the length of that spinal cord. And these things aren't necessarily designed to stretch too much for long periods. So it's worth bearing that in mind as well.
Very interesting.
That's why we go on about doing the right exercises, because what you're basically, your sciatic flossing or your chin tuck exercises are saying is stretch the living daylights out of your whole spinal cord. And it's not too good.
Okay, so just for Sally, so she doesn't really have that much pain in the neck at all, but should she be doing the exercises?
She should be doing the towel exercise at the very least. I would say at the stage that you're out, Sally, you might even be able to do the towel at the same time as the lower back towel. It's not something you need to be overly OCD about. You don't need to get into it in too much of a big way, but actually just doing that as a daily practice alongside your towel can be quite good. And I know we covered that because it's actually an indicated one for scoliosis patients as well. I'm not saying that's you, Sally, but for those with scoliosis, doing both at the same time can also be helpful. It's not something we normally recommend when we're doing remodeling though, so just bear that in mind.
Okay.
So we definitely do these exercises, it's the long short of that, particularly the towel.
We got there. Awesome, brilliant. I hope that helps you, Sally. I think that is everything for today, so thanks everyone for your questions.
Awesome. Lovely. Thanks so much for joining us, guys. Sorry about the slightly different time today, but hopefully you found it really, really helpful. It's a little bit off topic. We're normally doing the lower back, today we've covered the neck. Hopefully you did find it helpful, and we look forward to seeing you guys tomorrow with another